IV ketamine has transformed our treatment of depression, anxiety, chronic pain, PTSD, and even addiction. When used responsibly, IV ketamine can tremendously help patients when they feel stuck by addressing the root causes of why they feel stuck, unlike traditional medications. I've shared a video linked below of a live patient's IV ketamine infusion experience, and in that video, I describe just how powerful the preparation is before the medication is ever started. So in this video, I'm going to share the live conversation I had with my patient, answering all of his questions before we started his transformational IV ketamine infusion. And if you have other questions that I didn't answer, be sure to ask them in the comments below.
So what is the experience going to feel like?
The experience is different for every individual. Some individuals feel like they're floating, some feel like they're flying through space. It's almost like a dream where things will come to you in a different light than you may have ever experienced them before. And you're going to be safe and comfortable here with myself or the other doctor.
Will I talk?
Some patients do share personal things. It's very rare for anything secretive to come up, and if anything is shared, we keep it between ourselves like you would with any doctor.
Should I expect anything special or odd, given that I haven't really done drugs before?
So many patients come to us who have never tried any psychedelics or ketamine in the past. You should focus on the intentions that we discussed earlier, and as much as comfortably possible, let yourself release and surrender to the experience, to let it take you wherever it takes you, and not to feel concerned because you're going in uncharted territory.
Will I be alone?
One of our doctors will be with you here the whole time or just outside the door for you. And some patients like to have some solitude or alone time, but at all times we'll be with you to make sure that you're safe and comfortable. And if a scary experience happens, kind of like a nightmare, we'll be with you here to reorient it to make it a healing experience, not anything that's frightening.
What if I have a bad experience?
It's why we spent so much time in the preparation, so that your mind is primed. If something frightening happens, you have the confidence to ask that monster, what is it trying to show you? Instead of running away in the opposite direction, which might make the experience even more scary.
Will it affect my breathing?
We use ketamine in very, very young patients and even children and babies and old patients. And when monitored by a doctor, it's incredibly safe to make sure that your breathing is not impaired.
Will I be sleeping during the infusion?
We don't want anyone to fall asleep during the experience, and we want you to be awake enough to remember the experience so that you can take it with you over the next couple of days and weeks to integrate that with your therapist.
How long does it take for the effects to work? How long do they last?
The ketamine will kick in within a minute or two, and you'll begin to feel different very quickly. With your preparation and the guidance of today's session, we want the effects to last for weeks or months and hopefully a lifetime.
Will I get addicted?
Ketamine does have an addiction potential like many other medications that we use. However, that's why we use ketamine in a healing setting like this, with emphasis on growth and overcoming adversity to really minimize that risk, and why we want to use the fewest number of treatments to gain the maximum benefit.
Why did you ask me not to eat or drink anything before coming in today?
If there's food in your stomach during the ketamine experience, it's possible to get nauseous and to potentially vomit that food, and we want to minimize that risk.
What are the side effects that I should be aware of?
In this setting, ketamine has very few side effects. Some patients might feel a little nauseous, and we give you medications to help minimize that. Some patients may have a higher heart rate than before, and we also give medications for that if it happens. It's also possible to have a negative experience, kind of like a bad dream or what we call a bad trip. And that's why you've done all that preparation and we're here with you, so that if it happens, you're able to transform that into a healing and growth experience instead of it being a nightmare.
If I had any pre-existing conditions or illnesses, would this treatment not be appropriate for me, or would there be greater risks?
That's a very good question, and that's why the doctors in our clinic are all trained in anesthesia, emergency medicine, and in the psychiatric and psychological aspects of ketamine therapy to help make it as safe as possible, even if you have heart conditions like hypertension, heart failure, arrhythmias, or if you have any lung conditions or kidney conditions, so that we ensure your safety throughout the entire growth experience.
Will I remember what happens, or is there going to be any sort of amnesia?
That's our goal, for you to remember as much of the experience as possible, kind of like a dream, where you might forget your dream come lunchtime from the night before, but we want you to remember it and to grow from it in ways to help you heal from everything that we're here for today. I hope this demystifies the IV ketamine infusion experience and helps you better understand how this powerful therapy works. Remember to watch Alex's live infusion experience in that video linked below, and watch my other videos where I share how to spot ketamine clinic scams and how to pick a responsible and effective ketamine clinic. And you can always learn more by visiting me at my clinic, Claris Health, in San Francisco, or by joining my premium membership, where you can ask me questions live on our private live streams. And remember that you have more power over your health than you've probably ever been told.